The newly elected Liberal government promised that it was going to cap the number of temporary foreign workers entering the country at 82,000 in 2025. Yet, halfway through the year, they've already issued 105,000 permits. And now, our immigration department has been busted. That's right, guys. The IRCC was caught red-handed running this ad in foreign countries promoting our failing, crumbling healthcare system, while citizens that already live here can barely get basic services. This is a terrible look, even for Mark Carney. What's up, everybody? Welcome back to the channel. And if you're new here, make sure you smash the like button, subscribe, and leave a comment down below because I want to know if everybody thinks that this is an effective use of our tax dollars. I mean, seriously, guys, if you've had the misfortune of having to rely on the healthcare system in this country, you no doubt know how dire things have become. Unfortunately, stories like this are far too common in this country. Ontario couple whose teenage son died after 8-hour wait in the emergency room calls for law reform. And this is just one of many stories that you can find of people who showed up at the ER, they weren't seen by a doctor in a timely manner, and they died of something that they didn't need to die of. Like this kid, for example, died of pneumonia brought on by sepsis, which, if the doctors had been able to do their jobs, if they weren't so overwhelmed, they would have absolutely gotten to see him in time. It's truly tragic, but they're not alone. Look at this. More than 74,000 Canadians have died on healthcare wait lists since 2018. Now, the truth is, Canada's healthcare system has been circling the drain for a very long time now, and you certainly can't blame all of these problems on the recent influx of temporary foreign workers and non-permanent residents that really have exploded to unmanageable numbers during Justin Trudeau's government. But I'd really like to know who exactly thought that this was a good idea, given all the problems and strains on the system that already exist. Not only that, but it's just quite frankly dishonest. They are lying to these people, promising them something that the country really can't deliver. And Pierre Poilievre is calling this out. Liberal immigration at its best. They spend your tax dollars advertising to people overseas, promising them free healthcare if they come, while you can't find a doctor or get care. That's exactly what this is. And this article from Juno News really breaks it down well. So here we have, Liberal government advertises Canada's, quote, free healthcare to migrants. As Canada's healthcare system buckles under immense strain, the Federal Immigration Department is facing heavy criticism for a digital ad that promotes the nation's universal healthcare to migrants. And here it is from the official IRCC. Thinking about moving to Canada? Did you know Canada has public healthcare? Learn how it works, who can get it, and what services are covered. Get the details and helpful tips. Now, I've taken a look at the IRCC's website, and these so-called helpful tips definitely do not include any of these alarming statistics outlined in the article. Take a look at this. The ad's timing coincides with Canada recording its worst wait times ever. According to the Fraser Institute's Waiting Your Turn 2024 report, the national median wait between referral to a specialist and receiving of treatment is 30 weeks, the longest in the survey's history, and a 222% increase over the 9.3-week median in 1993. Look at this, guys. Back in the good old 90s, it only took 9.3 weeks on average between when you would see a doctor and get referred to a specialist. And before COVID, it had already jumped up to 20.9 weeks, 2023, 27.7 weeks, and last year, 2024, 30 weeks, and it's not showing any signs of getting any better. Now, those stats are bad enough on their own, but when you consider the fact that these are just national averages, your situation could be far worse depending on where you live. So this part breaks it down by province, and the lowest number on here I could find for 2024 is Ontario with 23.6 weeks compared to their 1993 wait time of 9.1. And if you live in Prince Edward Island, you're waiting 77.4 weeks on average compared to 17 weeks in 93. So the article goes on to explain how Canada's approach to mass immigration really hasn't helped the situation. And surprise, surprise, all of this was going on under Justin Trudeau. Part of the strain stems from a 2018 policy shift. then Immigration Minister Ahmed Hussein loosened the, quote, excessive demand rule. And what that did was it raised the medical cost threshold to approximately $20,000 annually. And this part is really important. That's about 3 times a Canadian's average healthcare expense. This allowed entry to many previously inadmissible on medical grounds, and this change intended to align with Canada's values of inclusion, and it also drew warnings that it would worsen pressure on an already struggling provincial system. No shit. And just this past July, the government prioritized invitations for seniors who were relatives sponsored by other recent immigrants in a family reunification program, which will see 10,000 parents and grandparents this year alone. Now, the IRCC ad remains online, directing users to an overview of how newcomers can access provincial health plans. However, critics argue it overlooks the significant bottlenecks that Canadians face. While it's true that all of these problems occurred under Justin Trudeau's previous Liberal government, Mark Carney is trying desperately to convince Canadians that he is addressing the issue when that couldn't be further from the truth. So Table Salt makes this point. Mark Carney says that businesses tell him access to temporary foreign workers is a top issue for them. Of course it is. They don't want to pay more.
I've called this morning on the government to scrap the temporary foreign worker program. Is it time to shut the program down?
Well, I would say the following, which is that that program has a role. It has to be focused in terms of its role. And it's part of what we're reviewing. It's part of what we will be discussing, how well the temporary foreign worker program is working and how our overall immigration system is working. We've been absolutely clear as a government that we want, and we're putting in place policies so that the overall level of immigration as a proportion of the population will decline from around 7% today to around 5% several years from now.
Now, he's talking about a decline from 7% to 5%. And while that sounds like a big number, it really isn't, considering that in the early 2000s and the 1990s, this number was sitting at around 2% total. It really just goes to show you how they've moved the goalposts and normalized this.
Now, the biggest contributor to immigration is not temporary foreign workers. It's a variety of other factors. And I will say, et je vais répéter en français parce que c'est important, when I talk to businesses around the country, particularly in Quebec, but elsewhere across the country, their number one issue is tariffs, and their number two issue is access to temporary foreign workers. Okay?
Mark Carney just said the quiet part out loud. He basically admitted that he is beholden to the interests of big businesses who want nothing more than cheap foreign labor that they can exploit. And the worst part about this is, these liberal elites and their sycophantic supporters try to say that any criticism of mass immigration somehow makes you a racist, when they are quite clearly exploiting these people and giving them promises of a better life, housing, a good job, and now better healthcare, which quite clearly is not the case. But that's going to be my show for today, guys. Let me know what you think down in the comments. And as always, smash the like button, subscribe to the channel, all that good stuff. And I'll see you in the next one. Peace.
Johnny from Nova Scotia says thank you. Hey, Johnny from Nouvelle-Écosse, il dit merci, thank you.
Thanks to you. God
Thank you
bless
so
you.
much.
We're from Quebec.
Yeah, Quebec.